Hello, everybody. Thank you so much for joining us for the MSN Nurse Practitioner Virtual Information Session. My name is Tom Crash. I am our Director of Graduate Admissions. I will be hosting the event tonight along with Dr. Schaefer. The event should take probably around 30 or 40 minutes. Dr. Schaefer has a great presentation that she will be going through, and then we'll be opening up to Q&A afterwards. This event is being recorded, so whether you're watching the live portion or you're watching the recording, we appreciate you taking your time and spending it with us to learn more about the Nurse Practitioner Master's Program here. Dr. Schaefer, did you want to introduce yourself?
Yes. All right. Well, thank you, Tom. And thank you, everybody, for joining us. It's nice to see that, we have a pretty good sized crowd. I'm sure you all are very busy, so we appreciate your time to join us this evening to learn about our Nurse Practitioner Program. So I'm Dr. Jennifer Schaefer. I am the chairperson of the Graduate Nursing Department here at Commonwealth University. The Graduate Nursing Department is located on the Bloomsburg campus. I'm not sure how much you know, we've recently had an integration a couple years ago, so we are now integrated with Lock Haven University as well as Mansfield, which we're all in Pennsylvania. So we have a very large footprint here at the university, which is wonderful because we know with the healthcare shortage that there is. So we really are. I forget how many counties we're actually in now. Tom, do you know that?
Yeah, a lot.
Yeah, I think it was
I want to say like maybe 10, 15.
Yeah, 10 or 12. So we have a big footprint, so I am also the coordinator of the nurse practitioner programs here at Commonwealth. We do have two nurse practitioner programs. They are primary care program. We have the Adult-Gerontology and we have the family nurse practitioner. But I also wanted to just mention some of our other MSN programs that we do have. We also have nursing informatics, which is a new program. We just started enrollment with that last year. We've already seen a really nice increase in enrollment with that. There's a big interest. We also have public health, a master's in public health. We have a master's in nursing administration with the option to do a dual degree of an MBA along with that. And we also have, is that it? Maybe I got them all. Well, we also have a nurse anesthesia program, which is actually a doctorate program. It's a BSN to a DNP. And we are in the process of adding some new programs. We are working with a consultant to add a psych mental health NP program, and also a master's in nursing education. So we've been very busy. But our goal is our graduate programs to continue to grow. There's just such a huge need for nurses with advanced education. So we certainly want to be able to fulfill that need.
And we were just talking about that earlier, Dr. Schaefer, where a lot of these programs, they were born out of necessity. They were born out of market interest and student interest, and the field of nursing is just expanding at an exponential rate. There's a national nursing shortage.
Absolutely.
So this is hopefully, we're trying to create this nice springboard for people to launch their careers into advanced nursing. So that's absolutely all under the new Briner School of Nursing.
Yes, the Briner School of Nursing. We're very proud of that.
Absolutely.
So, I did have. Oh, go ahead. Go ahead, Tom.
So why the MSN? The first question is, why would a student want to do the nurse practitioner program? Just about everyone who's considering this is probably already gainfully employed as a nurse right now with the BSN, probably doing very, very well for themselves and likely very busy. Why would they want to give up their free time and re-enter the world of academia to advance their academic career?
Nurses we're kind of a funny bunch. This is what we do. We're constantly looking for like a new endeavor.
Right.
So, but that is what's great about nursing is, it really is lifelong learning with nursing. There are so many avenues. The MSN degree really opens the door to additional career options. I mean, when we look at all the career options that are out there for a nurse with an advanced degree, whether it be leadership, nursing informatics, like we discussed, quality improvement programs, nurse practitioner, patient needs. When I think of the nurse practitioner, patient needs are really more complex now. We are of course, facing a huge physician shortage. Nurse practitioners, time and time again, we have proven how effective we are at taking really good care of patients. Access to care has been a huge problem throughout the nation. Again, nurse practitioners have shown we are up for the task. I mean, we can fill that gap. Besides, the complexity of patients, we know that healthcare, we have a long way to go with healthcare, and nurses were the thing that's kind of unique about the nurse practitioner when we look at like physician assistant programs or even medical doctor programs is you're already a nurse, right? We already know how to communicate with patients. We know how to take care of patients. And we have a pretty good idea of some of the issues in healthcare and the things that really need to change because we want to promote better outcomes for our patients. I mean, that's the end goal is we want to provide really good patient care and promote those good patient outcomes. So, we have to kind of come together. We have to advocate for patient care, and nurses know how to do that. That's part of that basic education that we've all received as a registered nurse. We're taught that. And the MSN program builds on that. And the nurse practitioner builds on that even more. And we know the importance of evidence-based practice. So as a nurse practitioner, our practice is really based on evidence. The research is there, and that's what we want to do. We want to bring that research to the bedside because we want those better outcomes for our patients. Also, increased autonomy. As a nurse practitioner with an advanced degree, you will have increased autonomy and just an added sense of personal accomplishment. Higher pay, of course, we can't.
Right.
we have to address that, right?
I was hoping that was on the list. I'm like, that's got to be on there somewhere, I would
It
think,
is,
right? That's
yeah,
what everyone's waiting to hear, right? Yeah.
definitely. And I mean, I know now I've been a nurse practitioner for 16 years now, and when I look at um, the increase in pay that we've seen from when I started until now, it is really, significantly growing, which is great because we know, for years nurses were so underpaid for everything that they do. So I think we are finally starting to catch up with that, getting paid what we're worth. But also better hours, right? When you work in the hospital setting and, the shift work and the weekends and the holidays and that's not to say that you won't do that as a nurse practitioner. It's going to depend on your practice setting, but you really have a little more control over that depending on where, where you want to land in your career. But that's certainly a benefit. Most people that are coming back for their MSN, they're adult learners. The majority of them have families. They're working full time, taking care of parents. They have multiple responsibilities. And really having a better schedule is a priority. The other thing is you can own your own business as a nurse practitioner. In the state of Pennsylvania, we are getting closer to that independent practice. We've been trying for the past few years to get that approved in Pennsylvania. But even though we are still under a collaborative agreement with a physician, nurse practitioners, we can still own our own business as long as we have a collaborating physician. And again, hopefully that will change in the near future. So there's just so many opportunities for not just nurse practitioners, but for all graduate nurses, coming back and getting that higher level of education. And I did just pull some statistics before we jumped on here. I was just curious to see nationwide, there are currently 280,140 nurse practitioners in the US. In Pennsylvania, for those of you that are from Pennsylvania, there's 12,000 nurse practitioners. But when you look at the like 2.2 million registered nurses throughout the nation, only 17.3% have a master's degree and 2.9% actually have a doctorate degree. So I think, that advanced degree really is something, to be proud of. And it does really add a sense of personal accomplishment.
Yeah, it helps you become a leader in the field.
Oh, absolutely.
But no, those are all very compelling reasons to to give up that free time and really and I think the way you're kind of you've posed this is that this is an investment, right? This is an
Yes, very
investment in
much.
your future career. It'll help not only provide a better ROI, but it'll increase a lot of job opportunities and a lot of flexibility and independence. And this is like the threshold that you have to cross in order to get to those points. So
Right.
those are all great reasons. Thank you, Dr.
Mhm.
Schaefer. Can you
Yeah.
give us a program overview from a high level? Like what's the basis of the program? What can students expect?
Yeah. So currently our coursework is considered hybrid. Now what that means is our core courses are 100% online. We also have clinical courses that are online, but we call that it's just, we have synchronous and asynchronous courses. So asynchronous courses are those courses that you kind of work on at your own pace. Those are the majority of the core courses, like your role theory, your patho, your epidemiology, population health, those types of things. And then you get into the clinical courses. They're still online, but we actually meet as a group once a week for those clinical courses, which is unique to our program. A lot of the online nurse practitioner programs out there, they're just 100% asynchronous. So it doesn't really give you that opportunity to come together as a group with your peers, talk about what you're learning in clinical, talk about the various topics, but hitting the highlights and the things, stressing the things that are important. So we have found that students really do like that part of the program. I will say we are working on we have our new curriculum is currently with the State Board of Nursing. So we're hoping that our program will be approved for 100% online come fall. I don't really see why that won't happen. But at this point in time, students have been coming to campus, only like once or twice a semester, depending on the course, and that's usually in those clinical courses. But I do foresee that changing in the fall and going 100% online. As I mentioned, we do have the two concentrations, the Adult-Gerontology, which is currently a 45 credit program that will be reducing down to 41 credits. And then the family, individual across the lifespan, that's kind of the new term for the FNP now is that's currently a 54 credit program, and that will be a 50 credit program once that's approved through the state board. Our curriculum is very flexible. We do have part-time and full-time enrollment options. Like I said, I mean, our learners are adult learners. They're being pulled in many different directions, and we certainly recognize that. It's not easy for people to just completely stop working to go to school. So we do have the full-time and part-time options. I will say that if you do decide that you want to come to our program and you want to go full time, then we do recommend, probably going per diem or part time at work. Because once you get to those clinical courses, you do have to allow yourself 2 days a week to complete the clinical hours, which are 200 hours a semester. There's 4 clinical courses that are 200 hours a semester for the FNP. If you're doing the adult Gero program, then there's three courses that are 200 hours of clinical. So you do have to, give yourself that time. Our programs are both primary care programs. So when you graduate, you'll be prepared to go into like an internal medicine, family practice, a specialty clinic, a nursing home. There's many different, different sites where our students go and work. But it is not an acute care program. So I get the question a lot from students, that work in an emergency room. So they work in an ER as an RN, and they say, can I do that when I graduate, from the FNP program? Usually they require FNPs. My answer to that is you can, but we don't train you to do those procedures that would be done in an emergency room setting. So scope of practice is very, very important. So when you're choosing a nurse practitioner program, you need to know, what it is that you're looking for, because the scope of practice is going to differ, whether it be an inpatient type of position or primary care. And all of our program faculty are practicing nurse practitioners. So they're bringing real life experiences. They're very up to date on what's going on in the real world, as we want to say. So I think that's also very beneficial with our program. And you don't always see that in all the nurse practitioner programs either. But we really strive, if our faculty are teaching a clinical course, they are active in practice as well. This young lady, she is one of our graduates of our nurse practitioner program. I'm so proud of her. She's actually one of our doctoral students right now. She's getting her DNP degree.
She realized she didn't have enough, right?
Yeah.
wanted
She wanted to keep on going.
back in.
Yeah.
Jump right back in. And so Dr. Schaefer, you had said, you had basically a full nursing career working in the profession, then decided to go into academia and teach.
Yeah.
I guess, and you're still working then as a nurse practitioner right now?
I am.
Okay.
Yes. Yeah. So I work in an urgent care clinic. So I only work 1 day a week or so. I try to get 1 day a week is my goal. But I also do some rural mobile health care. The hospital that I work for has a mobile unit, and occasionally we'll get out to the community and we'll do like primary care visits in underserved populations. But we also go to school districts and do sports physicals and things like that. So
that's great.
That's
great. So that brings us to highlighting one of our programs. This is the Adult-Gerontology primary care program.
Yes. So our Adult-Gerontology primary care program, the population that AGNPs treat is age 13 and above. So it's adolescents, young adults, middle-aged adults, and then of course our older adults. So there is time spent in skilled nursing facilities as well as family practice and family practice clinics, but with the focus being on the older child and then up through adulthood, but also internal medicine clinics. Our AGNP graduates, they do have the capability to practice in community and hospital-based primary care clinics. We have students that go into patients' homes. We're seeing a lot more kind of hospital home programs now, primary care programs for homebound individuals. So these students, this is a great place for them to do clinicals as well. Also subacute and skilled nursing facilities and long-term care nursing homes and rehab centers. So, as all of our nurse practitioner programs, we NPs do work interprofessionally with other members of the care team. I mean, it's so important. We need to work with our nurses. We need to work with our physicians, with the phlebotomist and the physical therapist. And so, our program really focuses on that interprofessional practice as well. So, and just to mention, there is a nursing education is changing in a sense that our accrediting body, which is the College of Accreditation for Nursing Education, they have now decided that it's time that nursing programs move to a competency-based type of education. So it's not just, multiple choice exams anymore. It's, you're provided with the information, you're out in clinical, you're learning the skills, and you're doing it. Which, in advanced nursing education, that's what we do anyway. But along with this competency-based education, we're really focusing more on that interprofessional practice as well. It's just so important that, we all work together, kind of that medical home model of patient care is important. So, that's another change to our curriculum as we are instituting these competency-based standards of care now that are required by our accrediting bodies. All right.
Oh, go ahead.
Okay. So the family or individual across the lifespan nurse practitioner program. So this program, again, is primary care. The population focus is infants all the way up through, older adulthood. So it is across the lifespan. it prepares the graduate to value collaborative, family-centered care, as well as interaction among the physical, emotional, mental, and sociocultural systems of patients. And again, it's we want those better patient outcomes. We know that we have a lot of patients that struggle to get access to care. We have a lot of patients that are in underserved communities where it's hard to find physicians. They just don't come out of the woodwork, right, to go work in central Pennsylvania in a rural community. So these are areas where nurse practitioners just do a phenomenal job in filling that gap. So, and really focusing on those sociocultural, that holistic care of the patient, which nurses do so well. There is a strong emphasis on meeting the needs of the community, multicultural populations. We're really trying to increase the diversity, learning more about cultural values and instituting that in the way that we care for our patients. And again, just that interprofessionalism, we really strive within our program.
So then the coursework, can you walk us through some of the classes, some of the coursework that people might be engaged in?
Sure. So family theory, right? Nursing, we can't get away from theorists no matter how badly we want to. So we do take a look at not only family theory, but I should just say advanced nursing practice theory. Basis of research for advanced nursing practice. Again, we know that our practice is based on research. It's based on evidence. So there is a research course, diagnosis and management of adults and children. There's actually two. There's diagnosis and management 1, diagnosis and management 2. Both of those courses do require 200 hours of clinical. And you would start those clinical courses depending on if you come in part-time or full-time. If you come in part-time, you would start your clinical courses the second year. So you could get your core stuff done first and then jump into your clinical courses. The comprehensive assessment of the older adult. So that is another clinical course that focuses on the comprehensive assessment. Again, the cognitive, the developmental, the physical, the emotional assessment of the older adults. Epidemiology and population health, though that is one of our core courses. Diagnosis and management of children and pregnant women for those that are interested in the family nurse practitioner program. This is an additional clinical course that you would take with just a specific focus on those two populations. And then at the end of the Adult-Gero or the Family NP program, we have the Family Practicum and Seminar. This is a student-led course. It's kind of it helps you to kind of review. You kind of put it all together, but we also talk about things like health policy, and insurance, Medicare, some of those kind of dry topics, but unfortunately we need to have them. We need to be familiar with them. But this is also, this is your final clinical course. So you're tying it all together. And by this point, our students are fairly independent, with minimal supervision with their preceptors. And so that's the last class you would take before you would graduate and take your boards. The lifespan health assessment and promotion for advanced nursing practice. So this is taking those, those health assessment skills that you learned in your undergraduate nursing program and advancing them. So you're really, kind of digging into that total head to toe assessment, identifying abnormal findings, learning to pick out the zebras, as we would say. So we have, a very comprehensive, our coursework, it's very competitive. Our credit load, when we look at our credit load with our programs, that was one of the things that we wanted to do when we did our curriculum revision, was we wanted to try to reduce the number of credits, but we wanted to instill those items into the curriculum that are just so important. Things that, evidence is showing us, hey, this is where we need to focus, and this is what competency-based education means. So The good thing about our curriculum is you're probably not going to get a fresher curriculum at this point, because every policy, every class, everything has been turned over, flipped upside down, revamped. So it is, up to date with the latest credentialing standards.
Dr. Shaver, can you talk about what a normal week might look like? Now, I understand no 2 weeks are the same. Let's say for a student who's taking maybe 6 credits, so that would be 2 classes.
Yes.
What does the course schedule look like? What's the typical amount of hours? What type of projects might students be working on? Like if you had to help preview people or help, provide a preview for people, what might that look like?
Okay, that's a good question. So most of our students take, 6 credits a semester. One course for our core courses is 3 credits. We don't want you living in here forever, right? We want you to get out. 5 years is our limit. We got to keep you moving and get you through the program within 5 years. But for 6 credits, you're probably looking at anywhere between, I would say, 5 to 10 hours a week of discussion boards and just reading and studying and things like that. Reviewing PowerPoint lectures. We do post those courses that are just 100% strictly online. We post lectures. You can kind of do that at your own time. I mean, everybody's very different. Some people, they just require a little bit more time. For me, I'm one of those people that I read PowerPoints and I look at them a couple times, and the first time is just kind of an overview, and then I do it again to really dig into those important points. So it's really different for everybody. Because our program is online, we do a lot of discussion boards, and that's kind of the way of bringing the classroom into the course and getting you to to communicate with your peers. Everyone has different experiences as a nurse. They're working in different areas, so it really is kind of nice to share share your expertise in your practice area. It gives you different perspectives, and that's really what we need to do as advanced professionals. Is we need to have different perspectives. We need to be creative, and these discussion boards help us do that. Now, with graduate work, as in any graduate program, there is more scholarly writing also that is accompanied by that. So I know that's probably not everybody's favorite thing to do. But just about every course, you're going to have at least one scholarly project, a paper, or when you get to your clinical courses, we'll focus more on actual health promotion projects, topics, developing PowerPoints, developing programs, telemedicine. So there's just so many things depending on the course. So it's hard to kind of say exactly how much time you would spend. But I would say for 6 credits, I would probably allow yourself a good, anywhere between 5 and 10 hours a week.
No, that's very helpful. Thank you. I appreciate that.
Yeah.
Job outlook. Job outlook obviously looks very promising.
Yes. Yes. There's not too many professions out there that look more promising, right, actually, than nursing and nurse practitioners specifically. So the average salary for nurse practitioners, as you can see now, this is a national salary, is around $120,000. Again, this has increased significantly. I know when I graduated, I was only making, I don't know, a couple bucks more an hour than I was as a registered nurse. So it was kind of a bummer. But you do have to also keep in mind that, for most registered nurses that are going back to school for a graduate degree, they're probably more at kind of the top end of the pay scale. And as a nurse practitioner, you're coming in at entry level. So sometimes there's not a huge gap between there, but it certainly is getting better. It also depends on, of course, your geographical area. We know, folks that live kind of more in around, bigger cities, tend to have higher salaries, nursing salaries. But yes, we're very competitive, and it is, like I said, the market analysis are continuing, and we do see our local hospitals anyway are fairly frequently adjusting to meet that.
And one of the things that is shocking is that last statistic there, 45%
Yes.
That is generally like between 5 and 10 is a big jump.
Yeah.
Okay. 45% is astronomical. And
Yes.
I think that's probably part of the reason why the salary is so high, right?
Hmm.
Is it's supply and demand. There's
Right.
not nearly
Absolutely.
enough nurse practitioners to meet the demand. So the ones that are out there can
Hmm.
command top dollar.
Yes.
That's good.
Yes. And you really can. You can almost, I mean, because there's so many positions that are available, you can negotiate. And, nurse practitioners are in a good position where they can negotiate. They don't just have to take the first job that's offered to them, and
Right.
they don't just have to take that first salary that's offered to them. And, these hospital-based systems and healthcare organizations, they know that. So, the demand is huge. So it really is a great time to decide to go back to school to become a nurse practitioner, and that demand is only going to increase. We have our baby boomers are retiring, so the average age of a nurse right now is upper 50s.
Wow.
So we have a lot of shoes to fill
Indeed.
there.
Yeah. Wow. Yeah. Holy cow.
Yeah.
That's right. So, our alumni, they're basically
Mhm.
everywhere.
Yeah. Yeah. So when we interview nurse practitioner student candidates, I love it when I hear, I talked to so and so, or I work with so and so who graduated from your program, and your program has a great reputation. And our program does have a great reputation. And of course, we're very proud of that.
Mhm.
Our pass rates, our last year's pass rates were 100% first time test takers for both our family nurse practitioner students and our adult gerontology nurse practitioner students. They took their board exam, 100% of them passed on the first try. So, we're really proud of that. Um, our alumni, they're, like Tom said, they're all over the place, family practice, internal medicine offices. We have a lot of our graduates go into specialty clinics. Cardiology is a big one. Because we do get a lot of students that come in from inpatient settings, such as ICUs and things like that. So cardiology, GI, neurology clinics, skilled nursing facilities for our adult Gero NPs, also even addiction centers, urgent cares, community health clinics. The VA has, primary care clinics. So there's the opportunities are just numerous. The list
And,
goes on and on.
and one of the benefits of having all these opportunities too is, for most people and most professions, you can likely pick the job. You probably can't pick the area, right? Or you can pick the area, but you probably
Right.
can't pick the job, right? There's a sacrifice, there's a trade-off to be made. This is one of the fields where in a lot of times you get to
Yeah.
pick the area and you get to pick like you don't have to sacrifice in either one. So the
Right.
additional degree opens up opportunity.
Hmm. Definitely. Absolutely. Um, yeah. So
And then we get to the fun stuff, right? The application, the process. Dr. Shaver, can you walk us through the app and then also what you might be looking for in a qualified applicant?
sure. So yeah, so it's easy to find the online application. There is a link right on the MSN on the nurse practitioner webpage. Um, College transcripts. So we do need a copy of your college transcripts. You can request those online. Most places just do it online now. Usually there is kind of a little bit of a fee, maybe $5-10 to get your transcript. If you are a graduate of it's my understanding, Tom, please correct me if I'm wrong. If you're a graduate of Bloomsburg, Lock Haven, or Mansfield, though, we can pull their transcripts,
That is
right?
correct.
Yeah, so you don't have to worry about requesting those.
Correct.
Um, we do also need a copy of your current unencumbered Pennsylvania professional nursing license. Now, with this being said, we are opening our programs to out-of-state applicants as well. But you do have to make sure that you check. If you're not in Pennsylvania, you have to make sure that you check with the State Board of Nursing in your state and make sure that they will accept our education credentials. Most states do. I know New York is a really tough one. New York doesn't play nice with many states when it comes to nursing education, but most states, are just fine. But you do want to make sure before you choose a program that they will accept that. your CV or your resume, which includes a description of your professional nursing experience and your clinical experience. Anything that you've done, if you've, wherever you're practicing, what special skills that you have that are unique to you and your practice. Even if you've done presentations, if you've gone to conferences, if you've, won awards, things like that, we would like to see that and hear about all of your accomplishments. And what are your career goals? So that's very important, because it's important to us that we provide you the education that you need to meet your career goals. So it really is a two-way street. We want you to do well, we want you to be successful, but we want to make sure that you're also picking a program that's going to meet your goals. There are reference recommendation forms that would need to be completed. We do request that you have 3 of those completed, and I believe they can be completed online. Is that right, Tom?
Correct, yes.
So, we need 3 references, somebody who can just, vouch for you that they feel, you would be a great candidate to enter into our MSN program. And we do also require 1 year of acute care experience. Now, I do get a lot of questions on that. So what that means, the acute care it's not just hospital. So if you work in a nursing home, or you work in a doctor's office or something like that, some type of outpatient clinic, that counts as experience. We just want to make sure, that you do have recent experience. And if you are a new graduate with your bachelor's degree, that's okay too, as long as by the time you get to those clinical courses, you've accumulated about 1 year of experience, because it's really important that you have, a good nursing base, and understand the function and the practice of the registered nurse before you move on to that advanced experience beyond, the RN, with your advanced degree. So, but I can certainly, answer any questions on that. I know sometimes people have questions about that 1 year experience requirement.
So, Dr. Schaefer, just a point of clarification. I know this is a question that we do get often. So, for a student who, let's say they just graduated this past spring with their BSN, and they applied for the MSN nurse practitioner program, in theory, if they're working full-time and therefore taking classes part-time, they could potentially be admitted for this upcoming fall under the expectation that they would have completed that year of acute experience.
Right.
So you don't have to have the year of acute experience prior to starting the program. You have to have the year of acute experience prior to starting the
clinical courses.
Gotcha.
Yeah, exactly. Because when you start those clinical courses, you're there as a nurse practitioner student. So, you are, expected to understand those advanced level skills and have that knowledge, which you would accumulate as, as a registered nurse. So yes, if you're a new graduate, that first year you would take your core courses, like your advanced, pharmacology, pathophysiology, role theory, research, all that. So by the time you got into your second year, you would have that 1 year experience.
Perfect.
Yeah.
And we do accept applications for the fall, the spring, and the summer.
Yes.
Right.
Yes. We have rolling up. We have a rolling rolling admission, I guess is the word I'm looking for. So yes, so we do accept applications. You can start at any semester. We do offer courses in the summer. Not as many, but there is an option that you can start in any semester.
Excellent. Great. Thank you. Yeah. And then Dr. Schaefer's contact information. So if anybody has any questions, please do not hesitate to contact Dr. Schaefer, myself. We are certainly happy to help in any way. Dr. Schaefer, do you have any parting information and any final advice or guidance for the group?
Well, I think what I would just like to say is I think it's wonderful that you're here and you've taken this step. So you're thinking about, about going on and getting your master's degree. So I applaud you for that. It is a sacrifice. I'm not going to lie. It's a sacrifice, but it's so well worth it. So I hope that, you reach out to me if you have any questions, And, you know, wherever you decide to go back to school, I hope it's here. But I wish you the best of luck. Because yeah, we need you. Healthcare needs you.
Absolutely. So, we're going to go ahead and open it up to a Q&A. We are going to stop the recording right now. So if you're watching the recording, again, if you have follow-up questions, please contact Dr. Schaefer or myself. We are happy to help. For those of you who are watching live, we're going to stop the recording and we will start the open Q&A. So thank you everybody for watching. We appreciate it. And we look forward to hearing from everybody in the future. Thank you.
Thank you.